I am so excited for you guys to hear Juanita's story because it's similar to other people that we see all the time, where the doctors are just very adamant that they need to have surgery, and it literally would not have helped because they didn't really get to the source of the problem. So we're going to hear her story. I'm excited. So Juanita, welcome.
Welcome. Hello. How are you, Stephanie?
I'm good. So tell us kind of a little bit about like your story, like from your neck pain and on.
Okay. Well, actually, all this pain started about 3 years ago. So I've been dealing with this for a while. I mean, it's been a long time. It all started like back on my neck, shoulder going down. I did go see my family doctor. And of course, they want to put you on medication, muscle relaxers, and all that kind of stuff. That does not help at all.
Yeah.
I tried some home remedies, and I did go to, massage people to do some massages and see if that would help. And then, even just medication, and none of that would help at all. The pain will go for a little bit, it will go away a little bit, but it will come right back. And I was dealing with this every day. And then it just got worse down through the elbow. It would numb my elbow completely if I would just stay still for a couple of minutes. Again, 3 years until about a year ago, I experienced my right thumb just getting locked. Went to the doctor again, did x-rays on my elbow and thumb. Nothing's wrong, but you do need to go see a surgeon. They want to refer me to a surgeon to do surgery, which nobody wants that. Because last thing you want to do is surgery. So got talking to my sister, and she said, why don't you just try physical therapy? And I'm like, physical therapy? I already did chiropractic too, like that's not gonna work. I already tried so many things. You get tired, and you just like, am I gonna live like this for the rest of my life, And so I tried it. I am so happy that I tried it. I'm not gonna lie, I didn't really think it was gonna help me at all. People do just like, you try so many things, you just don't know. That's gonna work. But I am so happy that I went to go see you, Stephanie, and your other staff that are so good too. And my thumb, I mean, it is just crazy that I can move it with pain. I mean, I do have a little bit of pain, but nothing compared to what I had when I first started going there.
Yeah. I was always just shocked because like when you're hearing your story, it started with my neck, then it went to my elbow, then it went to my thumb. And I'm like, okay, like, hello, it started with the neck. And when it goes down to the thumb, like there's a nerve that goes, that's that exact same area that you're talking about, the way you were talking about. I was like, this has got to be from the neck. And so that's where we had to start from. And I figured too, like with your thumb, that you had so much pain there that the muscles tensed up and created a trigger finger. And so we had to get rid of the pain first. And I remember the first visit, you're like, oh my God, what did you just do?
Yes, it was very, very, I was very surprised. Again, like I said, I didn't really think this was going to help at all. I was just like, okay, what the heck? I'm going to try it, I am so happy that I did. I mean, like I said, last thing you want is a surgery. So I am so happy that I went to y'all, and y'all been great.
And you wouldn't have, even if you would have had the surgery in your thumb, it would not have fixed anything.
Correct. Because it would have not done anything to my neck, my elbow.
No. Well, the pain that you were getting in your thumb was coming from your neck. Now, the residual effects from the neck that was creating the pain created the tightness that created the trigger finger in your thumb. So like we've had to go in and get your tendons and things to kind of loosen up. But that all started because of the neck.
Yes.
And if you didn't resolve that, you still would have had pain in the thumb on top of the surgery pain that would not have worked.
Correct.
So it's just crazy to me that someone is not going to sit down and listen to your whole story.
Yes. So, if anybody that I would talk to, or if they're experiencing any type of pain, they need to go to a physical therapy. And I'm definitely sending them to y'all guys.
Yeah. And I have to say, like, not all physical therapy is the same, because a lot of times you go to places and you'll see like 2 and 3 therapists, 2 and 3 patients per therapist. And so you just don't have the time. And they don't all have like the critical thinking skills, like the sitting down and asking the questions that we ask to really kind of figure some of these things out and put the pieces of the puzzle together. And a lot of times we can do that because we just have time. We have time to figure it out, and a lot of experience with like always being curious, like, well, why did that happen? Why isn't this working? Let's figure something else out type thing that we can get the results. What were some of your fears with your neck, hand, and thumb? If you couldn't get this resolved.
I mean, I just thought I was going to live like this the rest of my life. That is something horrible because you can't do your daily activities that everybody do. And just, having that every day in your life, it brings you down. You get depressed. I really just thought that I was just going to continue living like this. And I am, yeah.
Tell us your experience with the doctor's offices, like even with explaining, how everything started.
Just the fact that, my own MD trying to give me the muscle relaxers and just, you're fine, that's going to help. Just keep taking them. We'll do x-rays. It's not showing anything. It's very frustrating.
Mm-hmm.
You get to the point that, they're not really listening to you like they're supposed to.
Yeah.
They just try to just kind of like block you, push you away, but just giving you the medication. Okay, I'm going to give you something else to try.
Yeah.
Different type of medication that doesn't work, that is just going to take the pain for a little bit, but it doesn't even go away completely because when you do your activities, it's still bothering you.
Yeah.
And, it's a lot of frustration, a lot of stressful thing to experience, and just to, I mean,
it's just kind of what our healthcare system does. It's like we are going to take a picture and the picture is going to tell us what drug to give, or the test is going to tell us what drug to give, or what surgery we need to have. And they don't really sit down and figure out, like, our body has an amazing ability to heal if we give it the right environment, if we get to the source of what's going on. And honestly, like, medications and drugs only treat chemical side of things and rarely is an issue. I mean, like, when you've had an issue for 10 years or 3 years or 1 year, it is not chemical. Drugs will not touch it. It'll be like, yeah, I kind of like took the edge off, but that's about it. Because you're not treating the right category. Yours truly was mechanical, where there was stuff going on within the neck that we could show you how to take care of. And then we just had to like get all the rest of the pieces kind of resolved once we got to the source and just kind of like peel the layers back. But the drugs, like, that's the first defense that doctors want to give people. And I'm just like, oh my God, we have a drug problem in this country.
Yeah.
And you wonder why.
Yes. They want to solve problems with medication, drugs, and it's not. Yeah.
I literally like just Googled, because we have a back pain event coming up, and I Googled like back pain treatments options for patients. And the list was like pain medication, antidepressants, biofeedback, surgery, injections. Like, these are the top things they're telling people. I'm like, oh my gosh, no wonder we have a problem and people are frustrated, just like you, that there's no hope for them because nothing's working. I was just like, this is ridiculous.
It's crazy.
So tell us your experience with our office, and what would you tell someone if they were kind of on the fence about coming to our office?
I'm not gonna lie, I did hesitate going to the office just because of the fact that it's a distance for me. It's far, but it is well worth it. The staff is great. You are great. I have no complaints whatsoever. It's worth the drive going all the way over there. I mean, it is a 45-minute drive, and especially if you get traffic, but it is worth it. So anybody that needs to go with you and drive and deal with traffic, it is well worth it. So I strongly refer them over there with y'all.
Well, and I always tell people too, our office operates a little bit differently. We typically get people in once a week. So it makes it where it's not as bad. I mean, a lot of people are very busy in their lives, and so they don't have time to go to, 2 to 3 times a week for places where when people come in here, we do a lot of manual work and then go, okay, these are the things we need you to work on for, the next week or so. So it's not as bad from that perspective.
No, it's not bad at all. I mean, again, like it is worth it. And
just do it.
I am so happy with everything.
Yeah.
So
Well, I'm so excited that you're on today to kind of share your story, because people will have a story similar to yours and they'll relate to it and they'll be like, oh my gosh, I feel like there's actually hope for me, that there actually might be something that can help. And that those are the clients that we typically get. I mean, your story is like all of our other stories where it's like, I'm going to have to live with this for the rest of my life and nothing's really working. And until they actually come in and get results. So I'm so excited that you're back and your thumb is doing amazing, and everything is starting to resolve. I mean, I'm always amazed at the body and how it can heal.
yes, very happy. I am very happy.